Elizabeth Nabokera has come to review her patient who was brought to her house sick. Pavin Nankabira, 5 months old, was rushed to Elizabeth's house with a high fever, a bad cough, difficulty in breathing, which she detected as pneumonia and gave her some medication. After a day now, the baby is getting better.
She's not yet doing well. She's still having that heat.
Elizabeth Nabokera is one of the 2 village health team members here in Wakiso under the Integrated Community Care Case Management, where VHTs no longer simply undertake health promotion programs, but also offer basic treatment to children with malaria, diarrhea and pneumonia.
And the health worker will be able to determine based on the breaths they have counted in 1 minute. They have got respiratory timers, or they use a watch and they watch the child breathing. They will be able to determine if this child has got severe pneumonia, or has got pneumonia, or has got just a cough or cold.
Based here in Najemba village, Kasengeje parish, Wakiso town council, Elizabeth is able to serve more than 100 households. Pneumonia is a common problem among the children who visit her here.
Last week I received 10 children. 6 of them were sick of pneumonia, so I treated them.
After realizing that some of her patients used to come in while it's raining, Mrs. Nabokera put up this structure where we found some medicine in it, some good mats and some drinking water where she treats her patients. The Malaria Consortium is implementing the Integrated Community Case Management System, ICCM, by working alongside the Ministry of Health in 25 districts across Midwestern and Central Uganda. The aim of ICCM is to bring treatment of the common killer diseases among children under 5 much closer to communities.
And sometimes the first 24 hours or the first few hours of sickness are the most crucial. So it's important to get treatment to the child as quickly as possible and of high quality. So this is why Malaria Consortium, supporting the Ministry of Health, is training VHTs in the community to be able to provide these services.
Here at Mulago at the acute care unit, they receive at least 10 children daily with severe pneumonia, and one of the reasons being late detection. They are put on these oxygen machines immediately to help them with their breathing.
Because it means their lungs are so much affected that they cannot perform their function adequately, so they have to be helped.
They need drugs quickly through their veins so that it can quickly reach the germ wherever it is in the lungs, and so they need immediate treatment.
A child with pneumonia presents with symptoms which include a fever, cough, flu, and difficulty in breathing. Malnourished children, premature babies, and those with low birth weight are particularly at a high risk of suffering from pneumonia.
What the parents can do is really, it starts with feeding the children adequately. Breastfeeding is recommended because the children get some protection through breast milk from the mother, and then adequate feeding.
A pneumococcal conjugate vaccine, which is a vaccine against pneumonia, is expected to be introduced in Uganda in April next year as part of the routine immunization schedule. At least 1.5 million children are expected to benefit from the vaccine by April next year. But before this is realized, medical experts encourage parents to immunize their children against the immunizable diseases, as this boosts the children's immunity against pneumonia.
Measles can complicate itself with pneumonia. So immunizing against measles is extremely important. Diphtheria tends to affect the throat. And when you prevent diphtheria in one or the other, you are preventing pneumonia.
The recently released 2011 Uganda Demographic and Health Survey reveals that although improvements have been registered, neonatal, infant and under 5 mortality continues to remain high. Experts believe that if more efforts are directed towards fighting pneumonia, which is now the #2 killer of children under 5 years, then the Millennium Goal 4, intended to reducing child mortality by 2015, might be achieved. ICCM needs to be extended to more districts in the country since childhood mortality is higher in rural areas than in urban dwellings. Irene Namialo, NTV.